Artcure diffusional patch, non-invasive method in disc herniation treatment. Lower back pain and neck pain account for the most prevalent disease for humans, following upper respiratory tract infections. This pain can occur in any age group and in every profession. Majority of lower back pain and neck pain is caused by disc herniation, EA hernia. There are 33 vertebrae in the adult spine. There is a structure between each vertebra bones that serves as a cushion called discus intervertebralis. These vertebrae surround a gel-like center which is called nucleus pulposus. Nucleus pulposus is a gel-like structure that contains approximately 80% water. The solid structure with strong elasticity surrounding this cushion is called annulus fibrosus. It holds onto the vertebrae with its special fibers. Hernia, disc herniation, is a medical condition in which a tear in the solid structure outside the disc allows the soft, gel-like portion to bulge out. If this bulging part compresses on the spinal nerves, emerging clinical cases is called the disc herniation disease. If bulging out and compress occur in the neck area, it's called the cervical disc herniation. If it's in the lower back area, it is called spinal disc herniation. Artcure diffusional patch, the art of treatment. Artcure diffusional patch is an effective and safe treatment method due to its high clinical success provided in a short time and its low rate of the side effects. It's an alternative to current treatment protocols. It's a new system that makes its effect so deep and naive as an art performance without harming. Artcure diffusional patch is applied transdermally. The gel released through the patch acts in the herniated zone. Its mechanism of action includes decreasing regional intradisc density in the herniated zone and shrinking the current size. Patch ingredient reaches nucleus pulposus together with formed carrier oils Oleum limonis and Oleum rosmarini. It causes a substantial decrease in the volume and weight of herniated nucleus pulposus, which contains 80% water, by enabling the evacuation of water inside of it. Nucleus pulposus that lost weight and volume make less pressure on the nerve roots and the spinal cord itself. This results in the clinical recovery. Patient's MRI is required to be able to apply Artcure diffusional patch. This requirement is necessary to give the correct medical intervention, because not each lower back pain and neck pain are hernia-driven. The application method is very quick after the decision is made that lower back pain and neck pain are hernia-driven according to MR results. First, open the special packaging of Artcure diffusional patch carefully and take out the hypoallergenic adhesive tapes of the box. Take out the aluminum package containing the patch. Let the stay product in horizontal position for 5 minutes before use. Hold the aluminum packaging upright. Open the packaging with a scissor from the top, taking care not to damage the product inside. Take the patch out of packaging. Tear one side of the top protective cover and pull aside. Let the patient lie facing down, his back pointing upwards. Place the patch so that perforated part, which is freed from the protective tape, touches the skin. Make sure to align the patch with the spinal cord and to the center on the herniated zone. Peel off the paper cover on the hypoallergenic strips contained in the box and place on the patch to fix it in place. Repeat using other strips to cover the entire patch by placing them partially on top of each other. When applied in the neck area, place the patch to contact the skin approximately 1 inch below the base of the neck. Using hypoallergenic adhesive strips, cover the entire patch. Artcure diffusional patch is a medical device that works with intradisc density change. It has mechanical effects. The system which provides the mechanical effect is the formed oil molecules present within the content of Artcure diffusional patch. Disc is in a vascular tissue, so it does not fit with blood. It supplies its nourishment through diffusion. Surrounding wall of the gel-like interior section is of controlled semi-permeable nature. Experimental studies on rabbits have shown that permeability of outer wall of the disc increases at sections whereby structural degradation of tear occurs, and it becomes possible for formed oil molecules inside the Artcure diffusional patch to penetrate. Again, experimental studies on rabbits have shown that formed oil molecules cannot penetrate into a healthy disc whose surrounding walls is not damaged and is not herniated. Product safety have been proven in cytotoxicity, irritation, sensitization, and genotoxicity tests. Although it varies from the one person to another person, gel content absorption is completed within the first 8 to 12 hours after the patch application. It's normal to see pain increase in patients during this period. Analgesic support can be taken in cases deemed necessary by the physician. After the 12th hour, liquid starts to discharge from the herniated zone because of the change in the density and the osmotic pressure in herniated zone, and this period may continue until the end of 24th hour, although this period varies from one patient to another patient. During the entire period for 24 hours, the patient should lie flat on back and make a bed rest in order to decrease the load on the disc. After 24 hours, the patch is removed from the body and the application is completed. A quick improvement is seen in the first 24 hours after the completion of Artcure diffusional patch use. A quick improvement in patients' clinical findings is seen 24 hours after the patch is removed. Artcure diffusional patch shows impact with high success rate when applied to the right patient. Artcure diffusional patch has extremely low total treatment cost in comparison with other treatment methods. Artcure diffusional patch has a high economical advantage when DP's cost efficiency evaluation is done. The rate of reoccurrence of the disease is very low because anatomical integrity is not broken during Artcure diffusional patch application. Symptoms improved patients should continue to protect themselves against the impacts that may cause disc herniation in their daily activities. It is sufficient to use Artcure diffusional patch for once. The second dose may be needed for some patients. This application can be repeated in 1-2 week time with the recommendation of the physician. Artcure diffusional patch may cause rash on the application area of the patients with sensitive skin. This rash recovers in 3-4 days without any permanent trace. You can use your regular medicine together with Artcure diffusional patch application. No negative interaction is experienced. Artcure diffusional patch is a registered non-invasive method with low side effect incidence that may result in a short time. Use was started 3 years ago. Around 50,000 patients in Turkey and in the world regained their health rapidly with Artcure diffusional patch.